There is more to psoriatic disease than meets the eye. Psoriatic disease is a progressive, systemic inflammatory disease that presents a wide spectrum of clinical manifestations and comorbidities and substantially deteriorates patients' quality of life. Skin is only part of the story. There are visible manifestations like plaque psoriasis, scalp psoriasis, nail psoriasis, and palmoplantar psoriasis. Psoriatic disease impacts the body deeper than skin, with invisible progressive manifestations like psoriatic arthritis, spondylitis, dactylitis, and enthesitis. There are several comorbidities like obesity, arterial hypertension, diabetes, ischemic heart disease, and inflammatory bowel disease. There is diminished quality of life, decreased mobility, depression, psychosocial burden, and decreased work productivity. Psoriatic disease requires an early intervention with a complete treatment approach. The goal of psoriatic disease management is an early, complete treatment approach to holistically minimize the disease impact on patients' lives.
Welcome to Weekends with PsorPhil.
Yes,
And
welcome po.
I'll be your host. I'm Paul. And with
And
my
I'm
co-host
Joms. Yes, Joms. Anyway, so yun nga po, good evening po sa lahat.
Ang topic natin tonight would be COVID vaccine and psoriasis. Ngayon, pag-uusapan natin more on the safety protocol and guidelines of adhering ba? Pagbigay ng vaccine para sa atin mga kabalat.
About the psoriasis bill, napakaganda ng nilalaman niya. If you have time, to our viewers, to our kabalat, you can check that on our page. Makikita nyo doon, just open the draft and makikita nyo doon yung mga pwede natin makuha. That includes the topicals, yung biologics, marami pa. So I'm really praying na sana talaga maisakatuparan at masuportahan po ito sa Congress at kung maakyat pa sa Senate.
So ito yung mga hinahangad talaga natin, no, as patients. So from monitoring to diagnosis to treatment, nandun yon, pati yung mga karapatan natin at sa social protection for us. Let's continue to pray, guys, na sana this time magawan natin, kumbaga mabigyan siya ng focus despite the concentration dito sa COVID. Kasi for last year, natigil yung mga negotiations natin with PhilHealth, with DOH, kasi everyone is concentrating on the pandemic. Pero let's pray and stand with us na ipagpatuloy yung paglaban natin sa karapatan natin bilang pasyente.
Tama. Regarding that prayer, Kuya Pong, I'm also praying and I always include these people to my prayer, yung mga patient rescue natin. Kasi alam naman natin na itong mga tao na to na tinutulungan natin, they don't really have much to sustain for their medication and we can do so much. But part of this program, ito nga, from the very start of the Weekends with PsorPhil, isinasama na natin ito. So yun nga po, you can be part of this for helping our kabalat. You may send your donations. We have 4 options. As you can see on our screen, we have the bank, the PayPal, the GCash, tsaka yung Paymaya. So yun nga po, basta pagsamasamahin lang natin lahat, kahit man piso yan o kahit magkano man yan, basta pinagsama-sama natin ay may buhay tayong mababago.
Yon. So, yon. We also have this token of appreciation with you guys. So, if you're gonna donate a minimum amount of 1,000 pesos, you're gonna have Weekends with PsorPhil tumbler. So, this is a token of appreciation for you helping us, guys. You can contact 0922-808-5708 or 0917-427-8297 or 0939-640-7252. So you can contact Ate Liza or Coach TJ for more details on how you can help. Our guest speaker is a fellow of the Philippine Dermatological Society. He is a member of the Dermatopathology Society of the Philippines. He is also an expert in molecular dermatology and immunodermatology. He is also a consultant in the Southern Philippines Medical Center, and he is the head of their immunodermatology and gynodermatology. And we are really lucky tonight kasi our guest is one of the co-authors who wrote the position paper from PDS about COVID-19 vaccination and dermatologic patients on immunotherapy and biologics therapies. So without further ado, let me introduce Dr. Brian Guevara. Hello, Doc.
Hello, Doc. Good evening.
Hello, magandang lahat. Maayong gabi sa tanan. Hello. Thank you for inviting me in behalf of PDS and of course our authors, Dr. Ais Mendoza and Saibel Lui, for this very interesting topic for tonight.
Yes, that's right, Doc. This is really an interesting topic and I know a lot of our viewers are looking forward sa topic na to and ayun nga, Kuya Pong, ano nga ba ang meron? I heard na si Doc Brian. Okay lang ba, Doc Brian? Ganun lang po yung tawag namin sa inyo.
Yes, yes. Or call you Brian, no problem.
Yun, halos mukhang magkakasing edad lang naman tayo eh. Biro lang, Doc. Anyway, Doc, we heard that you're going to give us a presentation or a program. Tama ba?
Yes, po. Yes, I'll be sharing to all our viewers here in Facebook and also in YouTube about our position paper brought about by the Philippine Dermatological Society about COVID vaccine and of course mga pasyente na naka-immunotherapy. Included na po tayo mga kabalat or mga psoriasis.
Sige po, Doc. Kasi yun po yung pinaka-big question po na aming mga kabalat. Safe po ba na magpa-vaccine po kami na may sakit kaming psoriasis?
Yes.
So we will let the virtual stage to you, Doc Brian. So you can start sharing na po your presentation.
Alright.
Yes, go ahead po, Doc Brian.
So again, maraming salamat for this opportunity. And this is, of course, by PsorPhil. It's so amazing that you are really into educating people. Tinuturuan natin ang ating mga kabalat not only for their condition but of course their wellness as well. So I saw your previous episodes, napaka-helpful sa mga pasyente nating may psoriasis. Alright, so ngayon naman kasi mainit na topic ang mga bakuna ngayon. So especially yung COVID-19 vaccination. Nagsimula na po ang mga pagbabakuna sa mga healthcare workers. Ang tanong naman po, kung tayo ay may psoriasis at tayo ay nakagamot ng immunotherapy or even biologics, allowed ba tayo mga kabalat magkapabakuna? So let's just have a brief description in terms of what is the COVID-19 pandemic has brought about into our lives. So this talk, no conflict of interest. I'm a speaker of different companies, but in this topic, wala naman pong conflict of interest. I'm not promoting anything, but I'm only promoting educational purposes of the vaccine in behalf of our position paper by Dr. Ayis and of course Dr. PsorPhil Louis. So in behalf of the PDS, thank you for inviting me also to talk about this very nice topic for everyone. So ang COVID-19 cases per 100,000 population, napakarami. So let's not dwell on this, but look at this. The population ng Philippines around 100 plus million, but we have a lot of patients also affected by not psoriasis, but COVID-19 infection. So of course, tayo mga kabalat, I'm sure you are also cautious or takot tayong lumabas dahil sa pandemya na ito. At sigurado po, dahil nakagamot tayo, like for example, topical steroids, phototherapy or immunotherapies, and even biologics, ano bang epekto nito sa mga COVID-19 infection? So obviously, we still have a lot of cases, 591,000 cases as of March 7. And look at the trend, it's not yet going down, it's still going up. So hopefully, tayo sa Pilipinas, mapabakunahan na as much as we can, and hopefully, included na po tayo mga pasyente may psoriasis. Alright, so these are the top regions. So kaway-kaway mga nasa top regions, and hopefully we can more than flatten the curve, and hopefully we can improve, of course, the normalcy in our lives, especially we can work now. I'm sure if we can just have the psoriasis day, we can just go to the malls and have the fun. We can have the SOR walk, and we miss that as well. Even dito sa Davao, we do that, and of course, we need to celebrate as soon as we can, as long as napabakunahan na lahat at wala na po ang COVID infection. So ano naman ang question dito in terms of dermatology? Alam natin maraming mga sakit sa dermatology ay result ng mga immune dysfunction or may mga palya or mali sa mga immune system natin. For example, so psoriasis is an immune-mediated condition. It's chronic, it's auto-inflammatory, there's no cure, and sometimes kailangan po ng mga chronic or prolonged treatment, included na po yung mga immunosuppressives. Okay, so immunosuppressives like for example, systemic methotrexate, cyclosporin, yung biologics natin, napakaraming biologics ngayon. Are these safe for our patients planning to get the COVID-19 vaccine? So just a brief summary ng risk stratification for COVID-19 with commonly used immunomodulators in dermatology. Kung kayo, for example, ay nakagamit na, for example, methotrexate, intermediate risk po tayo in terms of getting or contracting the COVID-19. And so much with the high risk such as your cyclosporin and even your prednisone and biologics. So kaya tayo dito nakikinig, never self-medicate, lalo-lalo na ang prednisone. So napakadelikado po ang epekto ng prednisone para sa ating mga pasyenteng may psoriasis. Alright, so ito ang pinakamainit na tanong. Are COVID-19 vaccines safe for these patients or mga pasyenteng na may psoriasis at may immunotherapy? Right, so ang Philippine FDA may nitala na emergency use authorization. So ito ay kumbaga nabigyan ng authorization ng FDA para magamit sa Pilipinas. So ito ay yung Pfizer, BioNTech, you have your AstraZeneca, and yung Sinovac. Course. So these are the three COVID vaccines as of the moment na may EUA or Emergency Use Authorization. Ibig sabihin, pwede na po ito maibigay sa mga Pilipino. And there are different brands also and types of vaccine na nag-apply na po sa FDA para mabigyan ng Emergency Use Authorization. So just a brief introduction about mga bakuna. Marami pong klaseng bakuna. Okay? So meron po tayong ditong live attenuated or ginagamit po ang mga mahihina na virus, bacteria, or microbe upang ating katawan ay hindi magkaroon ng mga disease because of that. Instead, makakuha tayo ng natural protection because of that weakened virus or bacteria. So in summary, this is usually given after one or first or second dose, and mostly meron ng lifetime protection ating mga pasyente na nabigyan ng live attenuated vaccine. Example nito yung MMR, yung bata pa kayo, nabigyan kayo ng MMR, rotavirus, and even varicella, or yung chickenpox naman na bakuna. So very important to know the live attenuated. And I'll stress later kung pwede ba mabigay ang mga live attenuated vaccine para sa ating mga pasyente may psoriasis at immunotherapy. Pangalawa po, inactivated. So ibig sabihin, hindi na siya buhay. It's a killed version. Patay na po siya ng microbe or your virus or bacteria. Hindi siya as lakas compared doon sa live attenuated, and you might need several doses or booster doses to keep going your immunity para magkaroon kayo ng sapat na protection laban sa mga bacteria or virus. Example ng mga bakuna na ito ay flu, hepatitis, polio, rabies vaccines, at iba pang COVID vaccines. Ang subunit naman, I'm sure you've heard of the spike protein. Very important yung spike protein para ma-attach po yung virus doon sa ating sistema. At ito ay nagko-cause naman ng infection. So sometimes we can use also this type of mechanism to get just a spike protein. So ibig sabihin, hindi yung buong virus, only yung spike, kaya coronavirus, yung corona, ibig sabihin may crown. Okay? So we're just getting the crown para ito'y makabigay ng immune response laban sa virus. So example also, not only limited to COVID vaccine, is also your HPV vaccines, hepatitis B, shingles, pneumococcal, and meningococcal vaccine. And ang pinakahuli is the newest type, which is the nucleic acid. So it makes basically the concept of DNA or RNA. Ibig sabihin parang cookbook, no? So you got the cookbook, no? Instead of the whole virus or bacteria, you just got the cookbook and binigay nyo lang po doon sa katawan nyo to more or less copy the specific component of that virus. Okay, so kunyari, gagawa ka lang ng viral protein such as the spike protein instead of putting the actual virus. So you're just getting part of the DNA, and so that your cell can produce such protein, such as the spike protein, and can be used as an immune response for your body. So very good example are yung mga bagong bakuna like Moderna. So some of the COVID-19 vaccines are using your mRNA type of vaccine. So ano pang iba't ibang klase? I'm sure naguguluhan na kayo. Kunyari kung nag-shopping lang kayo ng mga bags or damit, ang gulo-gulo. So there are a lot, but only 3 are approved in the Philippines with emergency use authorization. So far, others are also applying, and we are waiting for it. And eventually magkakaroon na naman tayo ng mga bagong datos or information about these vaccine. But as of the moment, may 3 pong approved sa Philippines with emergency usage authorization. Yun ay yung Pfizer, okay, AstraZeneca at Sinovac. So iba-ibang klase pati, tulad dito, types niya, like Pfizer is mRNA, na pag-usapan natin yung which is a new technology, AstraZeneca, viral vector lang, and yung Sinovac, which is inactivated virus. Usually, ito yung mga traditional types of vaccination. And there are different dosing. Notice nyo yung Johnson's and Johnson, usually isa lang kailangan, but yung mga rest of the vaccines, they usually need 2 dosage, so sometimes 3 to 4 weeks interval, and after that you will get efficient efficacy against sa severe COVID-19 manifestations. Okay, so we'll later discuss kung important yung numbers na yun in terms of efficacy. Will you choose a higher type of efficacy? Mas gusto ba natin si 88% versus that of, for example, 50%? But remember, we can discuss this in terms of how the researchers did their clinical trials or their phase 3 trials. But hopefully, we can more or less shed light into this, and hopefully we can understand what is the importance of these types of vaccines. So just to make it short, no, para at least hindi medyo ma-confuse tayo. So we'll just focus on 2, okay? Because there's Sinovac and AstraZeneca. These vaccines are already given to healthcare workers, included po ako. We'll know later on ano yung nabakuna sa akin. So more or less, so we have the Sinovac and AstraZeneca. So as mentioned earlier, the studies showed in Sinovac for the healthcare workers, they can prevent mild COVID infection 50% of the time. However, pinaka-importante po yung prevention of severe type of COVID infection, which is yung ayaw natin kasi ayaw natin ma-hospitalize or even mamatay because of COVID. 100% po ang protection ng Sinovac. And similarly also with the AstraZeneca, which can prevent severe type of COVID infection in 100% of the time. So I think that is the essence of having these vaccines given here in the Philippines kasi number 1, it can prevent the severe type of infection. So there are also different subpopulations. So in Sinovac, usually they're allowed only for 18 to 59, but the AstraZeneca, they can be used in senior citizens as well, so more than 18 above. However, there's no efficient data also in terms of using this among less than 18 years old. So currently available for healthcare workers and hopefully soon on the general public. And there are like stratifications that we need to follow. We follow po natin yung mga DOH and government protocols in terms of sino ang next mapapupunahan. Hopefully also our kabalats here will get vaccinated in terms of their trench. All right, so these are a different algorithm also in terms of sino ba pwedeng bakunahan or hindi. Okay, so there's like questions also when you will get the vaccine. There's like an algorithm or a form that will more or less assess you kung pwede ba kayong mabakunahan or i-defer or maybe delay. Okay, so for example here, if you're younger than 16 years old in Pfizer and not among that age group, you cannot be vaccinated. Kapag ikaw naman po may allergy sa PEG or polyethylene glycol or polysorbate, which is a component of your Pfizer vaccine, hindi rin po pwede mabakunahan ng specific na vaccine na ito. And if you have mga allergies, severe allergic reaction after the first dosage, so you cannot be given the second dosage of your vaccine. So simple algorithm by the DOH, if, for example, kung may manifestations ka ng fever, chills, shortness of breath, difficulty in breathing, or basically if you're sick, kung may sakit ka, you cannot be given by the vaccine or any sort. So you need to be rescheduled after full recovery from the illness. So next, yung history of exposure. Doc, what if na-expose ako sa isang COVID-19 case? Okay, especially within 2 weeks, you cannot be given also by the vaccine. You need to be rescheduled after completion of quarantine of 14 days. So next, also previously treated for COVID-19 in the past 90 days. Kunyari, you can be rescheduled also after 90 days. Similarly with the convalescent plasma or monoclonal antibodies. And if you are pregnant in the first trimester, you can be rescheduled after the first trimester. And if you receive any vaccine in the 2 weeks, for example, you want to shift a different vaccine, which is not recommended by our specialists. So you can be injected still, but you have to be rescheduled after 2 weeks of completion po. All right, so this is again the summary of the algorithm in terms of giving or deferring the Sinovac vaccine. Take note na lang po dito sa pinakababa. Okay, so if you're diagnosed, for example, with HIV cancer, you can be given by a clearance or go signal by your attending physician. Similarly, also with patients tayong may mga psoriasis or other autoimmune diseases or in medication, for example, if you're on immunotherapy or other medicines relevant to your disease, I think you need to get a clearance from a board-certified dermatologist, PDS dermatologist, or rheumatologist for that matter in terms of psoriasis and psoriatic arthritis. So please do inform your doctors if you're planning to get a vaccine, and hopefully you can get a clearance also from these doctors. So ano bang PDS or Philippine Dermatological Society position paper regarding vaccination while on immunomodulating or immunosuppressive therapy? Kabilang na po dyan yung mga injectables or biologics. So in regards to type of vaccine, so live attenuated vaccine should not be given concomitantly with immunosuppressive or biologic therapy. So do not worry because sa mga bakuna na available dito sa Pilipinas, hindi po sila live attenuated vaccines. Okay? So in other words, you can be given. We'll discuss that further later. Pangalawa, so administration of non-live vaccines may be done to such patients. Okay? So we can discuss that later on. All right, so according naman sa National Psoriasis Foundation or COVID-19 Task Force, systemic medications, including your methotrexate, cyclosporin, and biologics for psoriasis and psoriatic arthritis, hindi po contraindication ito for patients planning to get a vaccine. Kasi ang National Psoriasis Foundation COVID-19 Task Force, they're based in the US. So basically, they just mentioned here the mRNA-based COVID-19 vaccine, for example, yung Moderna. So these are the only studies available in terms of specific recommendation from the National Psoriasis Foundation. So those who receive the mRNA-based COVID-19 vaccines may continue their biologic and oral therapies for psoriasis and psoriatic arthritis as scheduled. So, pangalawa po, so sa Pilipinas, so the vaccines approved by the Philippine FDA do not contain live or replicating subunits of SARS-CoV-2. So, therefore, all of the approved FDA vaccines are allowed for patients with psoriasis. However, again, just a disclosure, there's still a scarcity or limitado lang po ang data on safety on these vaccine because obviously it's still very new, okay? So again, so we should inform yung mga pasyente that they have to be properly counseled regarding the unknown safety profile in immunocompromised groups. Included na po tayo dito sa mga may psoriasis. Alright, so ano naman po ang epekto ng mga gamot na ito for psoriasis like your methotrexates, biologics, on the efficacy on vaccines? Remember, from the term itself, immunosuppressants or immunomodulators, it takes down, they weaken the immune system just for your condition to improve. Because again, psoriasis is immune mediated, so we're trying to control or modulate the inflammation or the immune system of our body. Okay, so remember, vaccine needs your immunity for it to provide its efficacy or laban sa mga virus or like, for example, this one, COVID. So is there an effect on these medicine in terms of getting a COVID vaccine? So ngayon, as mentioned earlier, since it's really new, so there's no studies yet in terms of these therapies on the efficacy of COVID-19 vaccine specifically. However, we can also look at other vaccines because, of course, flu vaccine and pneumococcal vaccine, matagal na po sila. So there are also data showing the effect of these medicines laban sa mga flu vaccine or pneumococcal vaccine. So one example is methotrexate. So methotrexate lowers or binabaan, mababa po ang humoral response sa seasonal flu or pneumococcal vaccine. So it's going to be less effective. So that's why we need to properly time the methotrexate and the vaccination. So a recommendation here is that temporarily discontinue for 2 weeks after immunization para magkaroon ng proper immunogenic response ang katawan mo laban sa flu and pneumococcal vaccine. I just want to stress out also yung flu vaccine and pneumococcal vaccines are also important vaccines against complications of COVID-19. So I do recommend patients, especially with psoriasis, to get your seasonal flu and pneumococcal vaccines as well, just to avoid the complications of your COVID-19 infections. So paano naman po yung mga TNF inhibitors or tofacitinib? So they do not significantly affect yung humoral response ng flu vaccine. However, sa pneumococcal vaccine, may epekto po siya. So binabaan na naman niya ang immune response in terms of pneumococcal vaccine. How about the biologics? You have your ustekinumab, secukinumab, and ixekizumab. Ang good news here is that they do not interfere with the immune response to both influenza and pneumococcal vaccine. So you can give it anytime you want. In other there's limited data or no data in other systemic therapies. So we're waiting for that, and hopefully we can learn more about these medicine against your COVID-19 vaccine. All right, so the summary here is that methotrexate, I'm sure everyone's like aware of this. It's an immunosuppressive. They can significantly impair the response of your body to produce an appropriate immune response against the infection if you're getting the vaccine. Okay, so definitely we need to more or less delay the vaccination after methotrexate, maybe 2 weeks. That's going to be better also for you. So on the timing, as mentioned earlier, non-live vaccines, it can be preferred to be given with patients on dermatologic condition if stable. Okay, so problem here is for our psoriasis condition, sometimes it can flare up, or maybe in terms of exfoliative dermatitis. Are you allowed to get the vaccine? For me personally speaking, I need to stabilize the patient first, hopefully control the flare, and I don't want any other adverse effect can aggravate the existing condition, especially for patients with exfoliative dermatitis. So kung marami ang lesions nyo and you're not controlled, please do seek the help of a dermatologist, especially a board-certified dermatologist, to control the flare of your psoriasis, and hopefully can get the vaccine against COVID-19. All right, so according naman sa American College of Rheumatology, so these are the recommendations in terms of timing and vaccination on immunotherapy. So as mentioned earlier, this is very relevant for us, especially on methotrexate. Hold at least 1 week or 2 weeks on each vaccine dose. All right, so on patients naman naka TNF inhibitors, interleukin-17 inhibitors, for example, secukinumab, ustekinumab, or ixekizumab, there's no modification to either immunomodulatory therapy or vaccination. So that's the recommendation of the ACR, or American College of Rheumatology. So for the allergies, so are we, for example, psoriasis patients or even other autoimmune conditions are at greater risk of vaccine allergy? So if you're asking someone, Doc, ako may psoriasis, may risk, mas mataas ba ang risk ko ng allergy after the vaccine, right? So again, so psoriasis is not an allergic condition, it's autoimmune, so it's more or less immune-mediated condition. It's not really allergy. So no evidence na ito ay mas mataas sa mga pasyenteng may autoimmune condition or autoinflammatory condition. From the CDC, or Center for Disease Control and Prevention, so COVID-19 vaccine is not contraindicated or hindi pinapagbawal sa mga pasyente who are receiving immunomodulatory or immunosuppressive agents. So it's a go as long as you have clearance from your doctor, as you have a right timing also, and you have controlled condition or sa inyong psoriasis. I think it's a go. So these are the common side effects of COVID-19 vaccination. I'm sure you have heard of a lot of comments in Facebook and even your Viber trends that there's a lot of quote unquote side effects, and sometimes these are fake news, and hopefully you need to more or less know how to screen the news in terms of this. So I don't want you to panic because you're just going to get a vaccine. And usually, what do you expect usually from a vaccination? So common po ang local reaction. So these are what we call reactogenic. Hindi po talaga sila allergic. Okay, so reactogenic, it's because of the inflammation and your immune response to the vaccine. So for example, pain or masakit or pamamaga or swelling, okay? So usually you can feel that after the injection. Sometimes meron namang headache, fatigue, fever, chills, but these are self-limited, or they are basically not dangerous for that matter, because you can just rest, drink, hydrate. You can also take paracetamol or other pain relievers. And less common naman po yung mga urticaria, vasculitis, okay? So sometimes there's coughing, itchy nose, sometimes itchy and red eyes. And pinaka-rare naman po, which is very rare, and anaphylaxis naman po. So anaphylaxis, these are the emergency cases. Usually they might die if not treated early, all right? So these are rare, and don't worry, there are ways on how to manage these patients and how to prevent from dying because of the vaccine side effect. All right, so ito ako. So I got my vaccine last week from SPMC, Southern Philippines Medical Center in Davao. I work there as a dermatologist, and these are usually. I'm afraid of vaccines. So I'm not afraid of vaccines, but I'm afraid of needles. So I'm not afraid of any vaccines. I got the Sinovac. Okay, without hesitation, I got the Sinovac, but I'm only afraid of the needles. So ironically, I'm a doctor and I keep on injecting patients with biologics, but for me, I still have this trauma in terms of getting injected. So kaya may dalawang nurse po dyan to hold me, just keep me still. So post-vaccination monitoring. So according to Philippine Society of Allergy and Asthma and Immunology, so at least 30 minutes after the procedure, after the vaccination. All right, so after, for example, yung napapakunahan ako last week, so we have to stay on an observation unit or area para ma-observe, like for example, your breathing, your temperature, your heart rate, your blood pressure, which is also to monitor you if ever you have an impending attack of allergic reaction or anaphylaxis. That is why you don't have to be afraid, because you have doctors and healthcare workers to monitor you even after the vaccination. So napaka-importante yung protocol ng DOH that we have to follow, because of course we still have to monitor you after the vaccination. Kasi for example, if something will happen like a severe allergic reaction, at least it's so near the hospital and you have doctors there to manage you as soon as they can. So ano bang conclusion ng PDS paper? Okay, so this is the recommendation for all of you with psoriasis and on immunotherapies. So recommended pa rin namin ang mga pasyente na naka-immunomodulator or immunosuppressive to be vaccinated by any of the Philippine FDA-approved COVID-19 vaccines to prevent infection. As long as you're stable, as long as you have the approval from your doctor, as long as you have no allergies or maybe reactions, severe reactions from the first dose, I think it's a go signal. And please do consult your dermatologist or rheumatologist for that matter if you're planning to get the vaccine. As long as you get the vaccine, you're going to be contributing not only for yourself or your family, but also for the whole Philippines. And as soon as we can get the majority of the Filipinos to be vaccinated, I think that's a one step forward normalcy. I'm sure you're so excited to meet each other and hopefully hug each other like in the psoriasis day, and how we do miss our normalcy already. All right, so again, patients must be evaluated on individualized approach, so with the benefits and risks clearly stated and understood. So again, hopefully we can get vaccinated the right way, and hopefully we cannot like rely our information to fake news. And hopefully with that, this Friday night session with the PsorPhil was really productive, and hopefully you learned something new today. And again, wag maging kampante. So you have, even though nabakunahan na po kayo, for example, in the future, wag maging kampante pa rin. So you have to practice good hygiene, okay, hand washing, mask still, according to CDC, even though you're vaccinated, you still have to follow these guidelines, including mask and also social distancing. All right, so these are the reference of our paper, and in behalf of the authors, our chair of PDS Immunodermatology, Dr. Clarice Mendoza from RITM, and of course, Dr. Sybil Uy, very hardworking, and all our immunodermatologists, subspecialty core group members, and of course, all the dermatologists in the PDS or the Philippine Dermatological Society. Maraming salamat po sa Sir Phil for inviting us, and hopefully someone here can make a difference. Salamat po.
Wow, grabe. Very informative, Doc Brian. I think ako, lahat ng questions ko nasagot, no? And I hope that everyone who's watching tonight ay nasagot mga tanong nyo at nakampante din po sana kayo na it's okay to get the vaccine. Ikaw,
Yes, that's
Jones.
correct. Well, that's correct. Actually, ang dami ko napulot. There are a lot of talagang questions, hesitations sa isip ko. Kasi syempre, di ba, for us Filipinos, we tend to believe in social media without even validating it. Di ba? Parang, minsan kasi parang yung social media na parang nagiging platform na dapat yun yung magiging basis nila. But yet, we have experts like Doc Brian to clarify things for, especially for psoriasis patients like us, that it's really safe, diba? Though there are algorithm that you have to follow from the DOH, kung ano ba yung mga preparation and what will be the things you have to do then after taking the vaccination. So, Doc, thank you so much. It's really an educational and informative night for every one of us.
Yes. Siguro, Doc, siguro question lang. Since kami as a patient, sabi nyo nga, before getting a vaccine, we need to coordinate with our doctors. So, just to, siguro, last words, Doc, na in a sense na, kasi like, we have a lot of circumstances or cases na matagal nang hindi nagpapatingin talaga sa doctors. Pero, yun nga po, when it comes to getting the vaccine, important po na we need to be seen by our derma or rheumatologist. Tama po ba, Doc?
Yes, Coach Paul, thank you. That's a very good question kasi we all know psoriasis, we have a lot of comorbidities. So number one question here is that, have you been seen by any doctor for that matter? Control, you're not only limited to the skin or your dermatologic condition or psoriasis, but not forget the comorbidities. So in standard protocol for getting a vaccine, you should have like controlled comorbidities as well. So ayaw natin na, I have may mga seatmates ako when I was getting my vaccine. So sobrang taas naman ang kanyang BP, no? So it's not uncontrolled. So similarly also for us with for our patients here with psoriasis, I think it's best to see a doctor hopefully before getting the vaccine. And yes, you're right. Best to see a board certified dermatologist, PDS doctor, and of course your rheumatologist as well. And hopefully they can enlighten you. Okay, so recently we just give like medical certificates that there's a go if you have like psoriasis, and hopefully po, yes, please do visit your dermatologist or other doctors so that they can more or less maintain the current status. For example, if you're stable, okay, so we have to avoid the flares and other complications for that matter po.
Yun. Thank you, Doc.
Thank you so much, Doc.
Another question, Doc. Like
Yes.
yung mga iba na, kunyari gusto nilang sigurista, parang, kunyari, gusto kong itry yung tatlo para sure. Anong masasabi niyo yon, Doc?
Right.
Suffice
So
na, okay na ba yung isa lang or what? Or when do you need to change the vaccine, Doc?
Opo, napakita ko kanina yung early algorithm in terms of if you want to shift the vaccine, okay, from brand A to brand B. So there should be a deferral or ibig sabihin i-delay natin. So we need 2 weeks again for it to be shifted. Okay, so I'm not saying that I don't know if there's like significant study again kasi bago pa ang mga COVID vaccines and there's like limited studies. I don't know if there's like studies or may mga datos na ba na pag napabakunahan ka sa vaccine A, then you shifted to vaccine B, for example, will it be more effective? But gusto ko lang remind ating mga listeners or viewers that we have limited supplies of vaccines, all right? So it's not efficient, it's not more or less wise to more or less shift kasi sayang kasi yung first vaccination mo, then you're gonna shift to another one. So again, we still have a limited supply, okay? So not only in the Philippines, but also all over the world. So as soon as we have wise decisions, follow the government protocols, DOH, CDC, WHO, I think that's gonna be the best way to more or less alleviate this pandemic.
All right. Thank you so much, Doc. With regard to the question of actually Kuya Pong, I'd just like to follow up on that since you mentioned about the limitations sa resources. I just want to ask, how long does it really take for the vaccine? I mean, how long does the efficacy of that vaccination, or how many shots needed? Tulad ng sabi niyo kanina, di ba, there can take 1 or 2, or how many shots are really needed for a patient to be fully protected from the virus?
Yes, it depends on the brand. You can see that also in our position paper. There are different types or different brands for COVID vaccines. So there's like 2 doses needed in interval of 3 weeks or 4 weeks, and there's like different brand also that may just need 1 dose. Right, so in terms of efficacy, it varies also. It depends also, but you cannot compare oranges and apples because the clinical trials are different. So, for example, the subpopulations, okay, or different populations in Sinovac, they have different populations for other brands as well. They have different populations. So, for example, a healthcare worker compared to a normal individual, of course, you have different efficacy rates. So you have different percentage. So that's why there's going to be confusion also among us or the general public. That's why you have different numbers and you want the highest numbers, of course. But the point here is that all of the vaccines will prevent the severe COVID infection, and all of the vaccines will prevent serious admissions or hospitalizations. Right? So ang bakuna kasi ay hindi para doon sa mga mild na manifestations. For example, we really don't mind that because of course, ang goal natin is no one should die because of the complications or even directly to the COVID vaccine. So ang goal natin is to have like avoided deaths of patients contracting the COVID-19. In terms of how long the immunity will last, I'm not the best person to answer this, okay? So, but there are varying data, and still the data is really new, so we cannot really say for certain. And hopefully, CDC or WHO will have that, and you can just read those information from those groups. But again, I think it's still very new. We don't really know the really good number in terms of how many weeks, 2 months, or even years. I really don't know.
All right. Thank you, Doc. Next question,
Alright,
Doc.
thank you, Doc.
Ito naman po, in case po na nagkaroon ng COVID or naging positive sa COVID, when is the best time for you to get the vaccine? Or is it safe to get the vaccine after getting COVID?
Yes, it is still recommended, even though you got the COVID infection from past months or weeks. So you are still recommended and to get the COVID-19 vaccine. Although you have this deferral algorithm still, so you have like nine months, for example, before you can get the vaccine. Right? So very good question. So the point here is that even though you got the COVID infection, you still have to get the COVID vaccine if you can.
All right. So yung
Alright.
yung para makuha niya, para mag-take siya ng vaccine, Doc, yung physician na po yung magsasabi kailan siya i-schedule.
Yes, yes. So all the healthcare workers, not necessarily the physician, you have the nurses also and different healthcare workers in the hospital, they will have this checklist also. So you don't have to know all these, as long as you have to answer the checklist as honest as you can. So hopefully you can have this vaccine and without compromising also other people. For example, you have like flu-like symptoms. Currently, you have like, for example, COVID manifestations. I think it's not wise to go there because, of course, there are monitors there that will assess your temperature, okay, or blood pressure, etc., and they will still defer you. And it's best if you can go there as if you're healthy, again, your comorbidity is stable, and at least you won't also be deferred, and it's not going to waste your time as well.
All right. Doc, follow-up question. How soon can you get the vaccine if you contracted the virus?
90 days. Okay, so if you got
90
like
days.
clearance, 90 days for that. You can double check also the DOH protocol. I just presented that earlier, and yeah, I think that's the case for that.
Tapos, Doc, meron pa dito para makalma lang din yung isip ng mga tao. When it comes to Sinovac, is it safe? Is it okay?
Yeah, I would. Yes, yes, a very good question, and sometimes very intriguing also from the public. Yes, if you ask me, is it safe? Nothing happened to me. It's except that I'm just afraid of the needles. I got the Sinovac vaccine. I didn't feel like all those nasty comments from Facebook or social media just because it's a China vaccine. For me, the local effect, like reactogenic effect, just tenderness and pain, not really the serious type of adverse effect or allergic attack. So I think the simple question there is yes, it's safe. I got Sinovac vaccine and I'm gonna get the second dose after a few weeks.
All right. So, Coach
All right.
Joms,
Oh,
do you have
actually,
a question pa?
actually na-address niya eh. Someone, actually si Coach RJ, he shoot me a private message regarding the pilot of the pilot ng vaccination day. Kasi tulad nga ng pinost kanina ni Doc, there are sample ng mga adverse effects nito. But in the Philippine setting, what are the really common adverse effects to patients? Especially siguro let's concentrate sa mga psoriasis patients po.
Right, so not only limited to the Philippines or patients with psoriasis, the most common are local effects. These are reactogenic effects. So reactogenic effects basically are because of the immune system and sometimes inflammation that can induce the manifestation. For example, tenderness, pamamaga, masakit, no? Okay, so sometimes meron ding systemic involvement. You can feel headache. Okay, so sometimes body malaise or other manifestations. But for patients with psoriasis, if, for that matter, if you want to do the subpopulation, there's no risk or no increased risk for that matter, no increased risk for allergic attacks. So I guess if you're like stable, you have no other problems, I think you should just get the vaccines without any hesitations and do trust your doctors, and of course, never forget to consult one.
Thank you so much, Doc. Can I just add one other question pa?
Yeah, sure. Go
Kuya
ahead.
Pong.
Sure,
Yes,
last.
last one. Doc, you mentioned earlier the things that we really have to consider, like the history of the exposure, yung mga systemic medication. And I just like to ask, or probably I might have missed that part. Sinabi nyo kanina that we have to discontinue the methotrexate 2 weeks after the immunization.
Yes, so
That is okay, go ahead, Doc.
yes, because although there's no direct study on methotrexate and COVID-19 vaccine, the only study was available for methotrexate in its effect on the efficacy of the vaccine were from flu vaccine and pneumococcal vaccine. So the research showed from those studies na mas mababa po ang immune response ng katawan mo after getting the flu vaccine and pneumococcal vaccine if you are on methotrexate. So ideally, we need to delay a week or two just to get the best efficacy of the flu and pneumococcal vaccine. And probably we can relate that to COVID-19 vaccine as well. Again, there's no study yet specifically for COVID-19 vaccine and your methotrexate use. But for me personally, I will follow the previous research on pneumococcal and flu vaccine that there will be a delay a week or two.
All right, thank you so much, Doc. So that's only specific for methotrexate, and you mentioned earlier yung biologics, wala namang kailangan i-discontinue. How about for topicals, Doc?
For topicals, no problem with topicals.
No
As long
problem.
as you follow the recommendation of your dermatologist. I know you're aware of this, Coach Jobs and Paul. A lot of patients are self-medicating, chronically using steroids. So I think that's going to be also an issue in terms of absorption of steroids in your body and making you immunocompromised as well. So again, you should not self-medicate for any matter, for like any products, including your steroids.
Thank you so much, Doc.
Thank you, Doc. We really learned a lot, and sabi ko nga kanina, nakampante ako at nasagot lahat ng mga tanong ko. Siguro,
very
Doc,
helpful.
before we end the episode, any last words na lang po, Doc Brian, sa ating mga nanonood, sa ating audience?
Last words, I think hopefully we can have the sense of normalcy as soon as we can by contributing to the community, especially in the Philippines, by following the strict protocols of DOH, by getting vaccinated. Do not follow fake news, avoid fake news, and hopefully patients with psoriasis will see PsorPhil as their kakampi in terms of educating these patients or even undiagnosed psoriasis patients, so that more or less we can help each other. We are here, the Philippine Dermatological Society is always here on your side, helping patients with psoriasis, and hopefully, and that's it. Salamat and daghan salamat. I saw comments from Cebu and Davao. Daghan salamat.
Thank you so much, Doc Brian.
Yeah.
Speaking of SPMC, naalala ko tuloy si Coach Rose. I think the president ng ating SOR Club in the SPMC.
Coach Rose is our one of the most active psoriasis club member and officer for a long time. Residente pa ako, nasa SPMC pa ako. So yes, shout out to our SOR Club members of SPMC Davao, and hopefully, we can plan more activities hopefully in the future, especially after all these pandemic.
Yeah, actually she's watching right now, Doc Brian. Nag-message.
Yes, she's very supportive.
Yes. And thank you also for this really educational platform for all the psoriasis club members. I'm sure everyone's like really keen into watching your weekend sessions with PsorPhil. So congratulations and hi to Sir Joseph. I met Joseph in Davao when we celebrated World Psoriasis Day sa Davao. Yeah, that's the first time I met him. He's a very dedicated leader in PsorPhil.
I just like to siguro echo yung sinabi ni Doc Brian na avoid fake news, because I think that's really the main core why other Filipinos, not only Filipinos, especially for us patients, kaya hindi tayo nagtitake. Just sa social media, if you just lit one fire, it's like a bush fire. Talagang lahat na, ayaw na talagang mag-take. But thank you, Doc Brian, for clarifying this topic for every one of us. Maraming salamat. Tulad nga nasabi ni Coach Rose and other patients, you can review that by following our official Facebook fan page, that's Psoriasis Philippines. Again, 2 words, Psoriasis Philippines.
You can check the replay on our YouTube channel as well. Just search PsorPhil. And don't forget to click subscribe and click the bell button so that you will get notified of our new episodes and new videos that are being uploaded in our YouTube channel. Again, guys, good night and have a good day. Thank you everyone for joining us tonight.
We would like to thank our sponsor, Novartis Philippines. Customized PH. We customized anything fabric related.